cancer is not going to kill me, and then people kill me here with sadness and sorrow and whatnot. So I was in American groups. I even found specific groups for triple negative breast cancer. And I thought, okay, I'm not ready for this huge surgery. And I'm not ready to lose my breast yet.
Yeah.
Then they said, no, wait. The doctor is coming now.
Yeah.
So we went to the doctor. The doctor was like, you have 3 blood clots in your lungs.
3.
I was like, these are the things, this is the ones that you find somebody has died without you knowing. You're like, we were laughing with them yesterday. When I was wheeled out, I found my husband waiting. And the first thing I asked him, have you eaten?
I'm the patient, Jamini.
Yeah, it was fun. Sometimes because we laugh at each other. Sometimes someone says, let's post our potato heads. You can't laugh at us, but we can laugh at each other. Me, I want to be around the people that I love. So even if I die, I am here with them.
Had you come to terms that may be the end? Hi guys, welcome back to A Dose of Health, the podcast where I give you not too little, not too much, but just enough health information to make you make an informed decision. My name is Dr. Hope, and today I have on set with me, I'll let her introduce herself. The floor is yours.
Okay. Hi everyone, my name is Eva Allela. I'm a pharmacist by training. I love skincare, I love beauty, and I am a breast cancer thriver. Yeah, so let's see what today has in store for us.
I love that. Now, before we usually start, I go through a journey to Inside Out. Have you watched Inside Out, the movie?
Maybe.
Or have you heard of it? It's about emotions.
Okay.
If you haven't, write it down. You need to watch it. It's a good one.
Bookmarked.
So where are you emotionally today? How are you feeling?
I'm all right. I'm good. I don't think there's anything weighing me down today. I listened to a podcast last night, Mel Robbins' podcast, and it was about 8 things you need to tell yourself every morning. One was, I'm going to have a great day. And the second one was, something cool is going to happen to me today.
Okay.
I don't remember the others. I think I fell asleep.
I was going to an 8. You remember all of them?
I fell asleep. So I'll probably pick up on the other 2 tonight. And by the end of the week, I'll have all the 8. Yeah, so I think that's the spirit I've carried with me since morning.
I love that. Actually, I started doing this thing. TikTok is the bane of my existence, but I love it. So there's this lady who was saying every day she starts her morning, she always asks whoever your higher being, mine is God, show me how good it can get. Let me tell you. And then you notice the smallest things that just make you realize, actually, gratitude, it's not so bad.
Absolutely.
Yeah.
Yes, it is.
Yeah.
And I think one thing I learned yesterday was that you need to channel your feelings or your emotions and be deliberate and intentional about it.
Yeah.
Because if you don't, something else will do.
Oh, for sure.
So better be in control.
Oh, that's, yeah. Actually, something else will do.
Yes.
Wow. Me, I'm that type of person. If I'm going through a tough thing, I will put it behind and we keep pushing.
You are my twin.
For real?
I know how to ignore things.
Even me. High performing, depressives, anxious people, all of them.
Yeah, sometimes people even ask me, how can you be so calm when all this craziness is going on?
Exactly.
I'm like, if I can do something about it, I will do.
Yeah.
If I can't, I'm not going to stress myself over it.
I feel like it always catches up with me. Let me say, it always catches up with me somehow. And I feel like I take a longer time to deal with it. So I'm just like, you'd have just dealt with it when you were there in it.
Yeah, makes sense.
But yeah, Mel Robbins, I think so. Yeah, something exciting will happen today.
Something cool.
Cool and exciting. Let me add exciting.
And me being here, I think is cool enough already.
Karibu.
Asante.
Okay, now, because you said you're in pharmacy, I love my medical jargon. What's one thing you want to debunk for the audience?
I know we all love Dr. Google. I think now we even have Dr. ChatGPT.
Oh, yeah.
We have Dr. Instagram, we have Dr. TikTok.
Yes.
And for us ancestors, we have Dr. Facebook.
Oh, yeah.
But always go back to your doctor. Yes. And if you need a second opinion, get it from another doctor. Because I see a lot of misinformation and misleading things on the internet and on social media, and ends up hurting us, whilst the right information was just maybe a phone call away.
Exactly. And sometimes you think, oh, it's not hurting me, but if you just look at the cost, cost-wise, I'm definitely sure it's hurting you.
Yes, of course, in the long term.
In long term.
You'll pay for
that's
it dearly.
Yeah, we are here to help. We are here to serve. So get your first, second, third, fifth, seventh opinions from medical professionals. My medical jargon is malignant versus benign, and they'll get the essence of the topic. So
Yes, sure.
why malignant versus benign is because we are celebrating Breast Cancer Awareness Month. Woo! So I get this question a lot. So what is a malignant lesion? What's a benign lesion? So malignant basically means it's cancerous. In using layman's language, the simplest. Benign means it's a mass, but it is not cancerous. Yeah, that's
Absolutely.
as simply as I can put it. All the more medical jargon, I'll just put it here for anyone who wants further information, but just to understand the two. Okay. So now, Eva, tell us why you're here.
So I'm here because, one, we are getting into the Breast Cancer Awareness Month.
Yes.
And this is a month when we create awareness, we educate, we inspire, we spread hope. And, we just demystify and debunk and just put all information we can out there about breast cancer. And most importantly, money is raised, funds are raised here and there for towards breast cancer initiatives.
Yeah.
Let me debunk something else.
Okay.
Before you contribute a cent of yours or give to anybody who says they're doing a course for breast cancer, please ask them where the money is going.
Oh.
Because there are people who use Pink October for their personal financial gain. Not a single cent of that will go towards helping any breast cancer patient. So please ask, where is that money going?
Okay.
Before you put your money into it, before you participate in any event or whatever it is that they're saying, we are raising money for breast cancer awareness, please interrogate and find out where that money is going.
Okay. I didn't know that, even me. So I'll
called
find out.
pinkwashing.
It's called pinkwashing?
Yes, it's called pinkwashing.
Wow. Hey, people are... Amogopi? You're not scared? Hey. To start off, I have some questions I want to see if you know the answers. They are simple. They're not hard.
Oh, well.
Yeah. They're simple.
I was in school a long time ago.
No. It's very relatable.
Okay.
Yeah, so don't worry. Okay. So which is the most common cancer in women?
The most common cancer in women is breast cancer. Let me just add.
Okay.
Because I know things. The one that kills most women is cervical cancer.
That's the next question, in fact. Now you've taken my question. But yeah, very true. Breast cancer, most common. Cervical cancer is the leading cause of death due to cancer in women. Okay, now there are three questions. Does breast cancer only affect men? Does breast cancer only affect women?
No. And as I maybe take you through my journey later in the conversation, I have a male relative who did have breast cancer.
Okay.
And I will talk more about the significance of that.
Okay. Correct answer. It does affect men. Last question. Okay. Screening for breast cancer can pick up things that cannot be seen or felt and would lead to easier and earlier treatment.
300, 400, 500%.
Okay.
We cannot underestimate the importance of screening.
Yeah.
And there are different types of screenings done, and each type of screening has its role and what it could find that maybe another type of screening will not find. So
that's true.
Screening is super, super important.
Okay. Now we've jumped the gun. Let's now take it a step back. You called yourself a breast cancer warrior. How did that start for you? Take us through your journey.
Okay. It started suddenly.
In the book, it started suddenly.
I wasn't looking for it. I wasn't even checking. There's something we call the monthly breast self-examination. I wasn't doing that.
Yeah.
I was taking a shower and I felt something hard over here. Then I was like, hey, what is this? I didn't feel it yesterday. I shower every day. My hand passes here every day.
Disclaimer.
Yeah. that where was this last night? It wasn't there.
Yeah.
And it felt kind of big.
Okay.
So I was like, okay. Cause for alarm, but let's just chill. It was December 2019.
Okay.
And actually that day, I was going on vacation, a road trip to Mwanza. And I said, watch out, because December,
Exactly.
who wants to start doing
Yeah.
hospital
Tony
things?
Mbele.
Yeah. So, like, okay, we'll deal with this later. So, did the trip, went and came back. So now I was conscious about, so every day I would take my hand there and I'm like, check, maybe it has disappeared, because I know that there are lumps that just come and disappear with women's cycles.
Yeah.
So I kept on hoping that I won't find it
Yeah.
one day. But it persisted until, so we finished Christmas festivities, traveling, nini. Come January, I changed jobs. So I was still busy. Then I had to relocate from Kisumu to Nairobi. So I was still very busy. Came to Nairobi in February. I eventually went to the doctor in March. It's not a good thing, guys.
3
Don't
months.
postpone it like that. So when I went, I saw the doctor. So the doctor did, she touched it and felt, and she was like, okay. Then she took my family history. So so we discussed, has any family member had cancer? So for me, my paternal grandmother, who died in the 1940s, they say it is the breast that killed her.
Okay.
So we don't know what happened, but we could assume that is breast cancer. Then the next cancer in the family was my father. He had liver cancer in 2000. He passed on in 2001. Then after that, my paternal cousin, daughter to my dad's brother, was diagnosed with breast cancer.
Okay.
She went through treatment, then later had a recurrence, which she unfortunately didn't make it. Then another cousin got throat cancer, same side, my dad's side. Then my uncle, my dad's brother, was diagnosed with breast cancer.
Wow.
I mean, it was like, men get breast cancer. Oh, wow. I think the unfortunate thing for male breast cancer is that it's not easy to detect as early as female breast cancer because they have less breast tissue. So it makes it easier for the cancer to spread.
Yeah.
So I think by the time it was discovered, it had already gone into the lungs and other organs. So he had a little bit of treatment, then passed on. Then I was next. Then after me was another cousin, female, sister to the one who had it before. She's doing fine now.
Okay.
So at least we are two who are doing well. So when I gave, by the time I was giving the doctor all this history, this younger cousin hadn't gotten it yet.
Yeah.
So after that, she said, okay, now she did, I was sent for a mammogram. When the mammogram results came, they said, there's a mass that has been seen. They recommend an ultrasound. And then I did the breast ultrasound, and the ultrasound found, said the lump looks suspicious. Then also found some small lumps in the armpit on the same side. Then after that, I was now referred for a biopsy. So biopsy, they took some tissue and sent it to the lab. And when this came back, so now this got into more details. That one, it's malignant, meaning the cells in this lump are cancerous. Then number two, they tested the cells, the cancerous cells, and this was able to determine the type of cancer that I had, which is a type called triple negative breast cancer. So this one, usually associated with the genetic predisposition. And especially when I told her that my male relative had breast cancer, it pointed to that direction. So after that, I was sent for other tests now just to rule out if the cancer has spread to any other part. Fortunately, it was confined to the breast only. So they did, they checked the stomach, they checked bones and everywhere else. Then now we got into a treatment plan. I started with surgery. So they removed the lump and a few lymph nodes to check. Fortunately, there was no lymph node involvement, which, the doctor was very happy.
Yeah, that's a good, it's a better indication.
Yes, but based on the size of the lump, the staging was 2A. 2 meaning it was under 3 centimeters. A meaning it had not left the breast into the lymph nodes. So after surgery, I recovered for 6 weeks. Then I went on to chemo.
Okay. Before we get to chemo, first of all, I feel like you've actually become the textbook. The way you're explaining, I'm just like, wow. Yeah. So, just a quick question.
Yes.
When you said surgery, was there a suggestion to have a mastectomy, or it was just lumpectomy? Like, did you have that conversation?
Yes. So the surgeon, she's a breast onco surgeon.
Okay.
She gave me two options. So
Yeah.
she told me we could do a mastectomy, or we could do a lumpectomy. So if I did a mastectomy, I may not need to do radiotherapy.
Okay.
If I do a lumpectomy, then I would need radiotherapy. So I asked her, what is the prognosis? What is the difference in terms of the outcome of these two?
Okay.
She said it's more or less the same.
Okay.
And I thought, okay, I'm not ready for this huge surgery, and I'm not ready to lose my breast yet.
Yeah.
So since she told me the outcome would be more or less the same, I chose to go with the lumpectomy and later radiotherapy.
Okay. So just because we have used jargon,
Yes.
lumpectomy is basically removing the lump. The lump. Mastectomy is removing the breast tissue, and it can be radical where they remove the breast plus the armpit. Now we have lymph nodes in the armpit. It can be radical, or it can just be a mastectomy. Okay. Now you've talked about risk factors, and actually family history is so important.
Yes.
And it's interesting that yours is strictly from your dad's side.
Yes.
Because there was no one in your mom's side who had any cancer.
No.
Wow.
Well, my mom did later get cancer, but it was not hereditary at all.
Yes.
She got stomach cancer.
Okay.
Those randomas that just appear from nowhere.
Yeah. Okay. Do you know any other risk factors that
Risk
you want to
factors?
tell the audience? Okay, we're always learning.
There's something I learned.
Yes.
Called dense breasts.
Yes.
So when I did the mammogram, the doctor told me, you have dense breasts.
Yeah.
Then I'm thinking, okay, what are those? She said that the breast has more, is it fibrous tissue than fatty tissue. So the risk one is that some of these scans may not pick up the tumor because the fibrous tissue also appears white.
Yes.
And second, apparently cancer grows faster in this type of tissue.
Okay.
That is something I read just the other day. I was like, okay. I discovered that there is a World Dense Breast Day sometime in October. There's a day for everything in the world nowadays. So that's the day I discovered that, I need to read up more on that. So don't take my word for it. Yes, it's something that I need to read up more on. So there's that dense breast. Unfortunately, you cannot know you have dense breast.
That's true.
Until the day you have your mammogram.
Yeah.
Which unfortunately is 40 plus.
Exactly.
And triple negative breast cancer actually gets younger women. It's more common in younger women. I think especially because of the genetic
component of it.
Yeah. So there's dense breasts. I have read about use of contraceptives being a risk factor for breast cancer. Cigarette smoking.
Yes.
Cigarette smoking, I think, is a
and
risk for all the bad things, and alcohol.
Excessive.
Yes, excessive.
Yeah. Excessive alcohol consumption.
I have read something about let me look for the right word for it. Having children late.
Oh,
because long time. I think cancer was common in older women, and especially nuns. They even used to call it the nuns.
Are you serious?
So I think that is why it was associated with not
having children. Okay.
Yes.
I'll debunk that a bit. So that one is linked to contraceptives. So mostly it's the estrogen element of contraceptives.
Yes.
So it predisposes you to what we call reproductive cancers. So breast cancer, ovarian cancer, uterine cancers, and the likes. And then now when you're pregnant, remember you go through 9 months of not producing as much estrogen. So it's more progesterone. So that's why we say you having kids reduces your exposure to estrogen and so reduces your exposure to some of these reproductive cancers. Yeah.
And I think to add to that, they also say beginning the menses early.
Yeah.
And late menopause because you have a longer exposure to estrogen during your reproductive.
Hey, this is the textbook here.
Because you have, do I remember any other?
I think the one I remember is now if you've had other reproductive cancers, like maybe you've had ovarian cancer or you have a family member.
I think a history of lumps as well. I forgot to mention I had a lump when I was 20. It was removed there was like, it's just those benign fibrous.
Yeah. Was it like a fibroadenoma?
Yes, a fibroadenoma.
Okay.
Yes, so I think that that is said as well. And then obviously, if you've had it before, it means you're at high risk of having it again.
Yeah. Okay, those are good ones. So now let's go to the treatment. So we've had the surgery done. And first of all, how long was the procedure?
The procedure was maybe 6 hours or so, because they removed the lump and then they removed some lymph nodes. So the lymph nodes had to be sent to the lab to be checked, so that if they found that there was cancer in the lymph nodes, then now they would continue the surgery and remove more lymph nodes. So they removed just, I think, 3 or 4. There's a dye they inject, which attracts something. So they're called sentinel nodes.
Yes.
You guys can go to what a sentinel is. It's an askari.
Put it here.
It's like a
literally it's a police.
It's like a soldier.
Yeah.
Yes. So they direct the dye to the soldiers who would have caught the cancer cells first. So those soldiers were found not to have cancer. So they just now closed me up.
Okay.
Yes. So I think there was a waiting period during theater when they were waiting for that result.
Okay.
So it took about 6 hours. I'll tell you something funny when I came from theater. So when I came out, I think after general anesthesia, people are kind of woozy and in some space. So when I was wheeled out, I found my husband waiting. And the first thing I asked him, have you eaten?
I'm the patient, Jamini.
He told me he was so embarrassed because it's like the nurses are wondering, why is this man?
A grown man. You don't have to take care of yourself.
I don't know why I asked that, by the way.
It's the natural in you, I guess. Yeah.
Yeah, we really laughed at that. He's like, of all things, that's what you... I don't know where it came
But I'm sure
from.
you're just like, okay, fine. Yeah, that is her. That's Eva. So we thank God that it's gone well.
Yes.
At least I like it when people have things to laugh at. Because I know it's a heavy thing, but just finding that soft thing to laugh at, it makes it a bit less...
less heavy.
You know, Okay, so how was chemo? Because I know chemo is not a walk in the park. Yeah.
So first, when I went for now the first treatment, so I went to my doctor and I had artificial sister locks.
Yeah.
And she asked me,
this one's a what?
Yeah, this one's is hair from God.
Oh, artificial. Okay.
Yes. So she asked me, so she told me, all the things that I would expect.
Yeah.
Including
it's okay.
Including hair loss, which I think is the one thing that everybody knows chemo does to people. So she asked me, what are you planning to do about your breath? I told her, I'll just let them fall off. She's like, no, you don't want to do that. You need to undo them. And another lady who was a survivor also told me the same thing. She told me, you don't want to wake up and find braids on your bed and all over your house.
Okay, yeah.
So I did the first chemo on a Thursday. And then Saturday I got the ladies who had put the locks to come home and remove them. Then I just did a ponytail. And so the first day, after the first chemo, like everybody was anxious. My sister came home. We got somebody to cook for a week because we didn't know what was going to happen.
Yeah.
So when I got home, I don't know, I had energy from where. I cleaned the fridge. I cleaned
after
the freezer.
chemo?
From chemo, we've gone home.
Okay.
Everyone is now watching. I actually become mad.
And no one wants to ask.
No, they're just like,
do we?
I cleaned up the fridge. I cleaned up the freezer.
Yeah.
I cleaned the kitchen,
Yeah.
I was just, I came to find out later that it was the steroids that were part of my pre-med. So there was a hyper thing going on with me.
Yeah.
So the first day, so everyone was afraid because, we see what we see in the movies, throwing up, dying.
Weak and frail.
Yeah, so me, I'm here. I'm not weak. I'm not frail. I'm just about to wash the roof.
Yeah.
So we had dinner nicely Thursday, Friday. Now Saturday is when now I started getting fatigue. And I was feeling, in Nairobi we say sijui aje. Because I really can't explain what I was feeling, but I was just off. But mostly what I remember was being very, very exhausted. And I think at some point I started getting a bit moody. Fast forward to the following week, that would be maybe 10 days since that chemo, 8, maybe a week or so. I just touched my hair and it came out. Then I was like, wait, okay. Now I patted it back and said, no, I was in denial.
Yeah.
Following day, another bunch comes off. So I decided, okay, it's time to shave this hair. So I went to the salon, and so it was a kinyozi sort of setup. They had. I said I want to shave my hair, so just put me there on those seats.
Of course.
There were Baba seat. I said, no, can we do it in a private place? So they took me to a room and needed the curtain. Then that guy came and found me, checking. Then he's like, what is nini mbaya?
Yeah.
I told him, no, I'm just going through treatment. So just knew all of it. I had carried a wig, my first wig ever. So shaved off all the hair, and then I put on my wig, and there my journey with no hair began. So my chemo treatments were every 3 weeks, and the weight it became heavier as I went on, because now I was more tired. I started getting pains that I can't explain. Sometimes I feel like my neck is stiff, can't move. I have a headache that it's weird headache. Then at some point, it's difficult to swallow. I got sores in my mouth. I got sores in my private parts, which I asked the doctor about. And she said that how chemo works, because cancer are fast dividing cells. So chemo targets any cell that divides fast, including the mucosa, which is the inside of the mouth, and the private parts. So chemo does not bagua. Any cell that is dividing faster
out
crosses with it. But I was given some medicine to manage every side effect that I encountered. So before every chemo, I would go see my doctor, like either in the morning or the previous day, does some blood tests and just checks my general well-being and assesses if I'm ready to go for the next chemo. My drugs were changed after 4 cycles, now to another one. The one I'll never forget, the first cycle, there's one that is a red liquid. In the cancer species, it's called the red devil. It has nasty side effects. In fact, you can't use it twice in your life. So because it also has it's bad on the heart. You guys call it cardiotoxicity.
Wow, big words.
So it is toxic to the heart.
Yes.
In fact, they check the heart before they put you on it. So if your heart is not, I don't know what word, they'll put you on they won't put you on the red devil. They'll put you on the cousin, who is not as toxic. Who is not as toxic as the red devil. So that time, for that period I was on chemo, I couldn't stand any red drinks. Even just red juice, I would see red juice, beetroot. I feel ew. Because I know, like when that thing is dripping like this, you just feel, you feel it entering your body. And it was kidogo. And it used to run for just 15 minutes. But it was 15 minutes of terror. Then, so one time when I went for one of my reviews before chemo, I told the doctor, nowadays I'm getting so tired. Like I just walk a short distance and I go out of breath. She told me, you might have clots in your lungs. Then I'm like, wow. She said, I'm sending for an emergency CT scan. So I went for the CT scan, came back. I was supposed to have chemo that day. And by the time I came back from the scan, it was like 1 p.m. thereabout. I'm hungry, I've not eaten. So I'm upset. I'm irritated and everything. So I said, I'm going home. I'll come for this chemo tomorrow. Because I need to go and eat. I've been here since like 8 a.m. Then they said, no, wait. The doctor is coming now. So we went to the doctor. The doctor was like, you have 3 blood clots in your lungs. 3? 3! I was like, these are the things. This is the ones that you find somebody has died without you knowing. You're like, we were laughing with them yesterday. I'm like, so I've been walking around with... Immediately I was put on blood thinners. So I started that day, and I was on the injections twice daily for the next, I think I did about 4 months. I actually was supposed to do it for 6 months. Then I went one day and I told her, I don't have any more place to dunga. Because I used to do my stomach. So today I used to pinch and look, okay, where haven't I dunga? Because everywhere was sore. Then she told me, we'd really prefer that you are on the injections, but they actually worked within a week. The breathlessness went away. I was like, oh, wow, okay. So she put me on tablets, thankfully. Oh, thank you, doc, I love you. So I was on the oral blood thinners now for remaining 2 months because she
months.
needed me to be on the drugs for 6 months.
Yeah.
So that is like such a huge risk. I would have died from that. So I asked her, so why did I get the clots in my lungs? She said, it could be 1, the cancer itself.
Yes.
Could do that.
Yes.
2, the chemo.
Yes.
And 3, the fact that you had a surgery. So you were...
So many risk factors.
Exactly.
Yeah.
I was a poster child for...
Yeah.
for
And also,
Nini.
were you mobile? Were you moving a lot?
I didn't mention it was COVID time.
Oh, that's another
But
one.
we used to walk. See, that's the time when everybody used to walk. But I think the weeks after surgery, I wasn't too mobile.
Okay.
But I tried, but not as mobile as I would like to be. So that could have also contributed to that. Yeah, so that is one thing that sometimes I think about it and I'm scared. I'm like, where? I would have gone
just like that.
Just like that. So the second phase of chemo, now that drug was causing something called bone pain. I never imagined that bones could be painful.
That's the wildest thing to me.
I know.
Your head, like, why are you paining? Like, you're just...
And then it's enough pain that, if it's a muscle, you can massage, you can press it, you can try to relieve it. But this one, and it's the pelvis, the knees, the femur.
The femur is the thigh bone.
What is
like, how do I...
Yeah. So for that, I would, do sometimes a hot water bottle. Sometimes I do a cold compress. Though it was, the warmth was more relieving than cold.
Okay.
So most of the side effects, we had like sort of home remedies of managing them because I joined lots of support groups.
Oh, that's lovely.
But not Kenyan ones. Because the first time I went online, the Kenyan support group I found was a sad place to be.
Okay.
It was, people were suffering. It was people who don't have food.
Yeah.
Dying, it was, that's not what I needed in my life at that point in time. I remember there's a time someone posted and said that she can't eat, so she needs a blender. And I replied and said, tell me where you are, I'm going to get you a blender. And she went quiet. About a week later, somebody comes to my DM and says, oh, do you still have that blender you wanted to give so-and-so? She died. Can I have it?
Just like that.
But that's when I left that group. I said, cancer is not going to kill me, and then people kill me here with sadness and sorrow and whatnot. So I was in American groups. I even found specific groups for triple negative breast cancer, where I met a Kenyan who ended up being my friend.
It's like I was here for you.
Because when I did my first chemo, there are people post, like they'll do a painting and post and say my first day of chemo. So when I posted, then that lady came to my inbox and she's like, are you being treated in this hospital? Then I'm like, yeah. Like, I knew it. I was treated there. I'm like, oh my gosh.
Hi.
And she just lives not far from me.
Yeah.
So at least I found somebody who I could work with within. So so I found like those support groups. And at night when I couldn't sleep, insomnia is one of the side effects. I would now get into those groups and, somebody posts and says, I'm going through this. What do I do?
Yeah.
And people will come with all the coping mechanisms that they've had. It was fun sometimes because we laugh at each other. Sometimes someone says, let's post our potato heads. You can't laugh at us, but we can laugh at each other. So
1 minute. Oh my goodness.
Like, Asha, look at me. I look like there's Uncle Festus. Is it a cartoon or is somebody?
Girl, I don't know.
Yeah.
Okay.
Look for Google.
Uncle Festus.
Uncle Festus.
Okay.
I think a man with a fatish kipara.
Yeah.
And the treatment also makes the face puffy.
A bit puffy.
So the head is shapeless. I didn't say the eyebrows went. The eyelashes went.
Oh my God, yeah.
Okay, all the hair.
Does hair everywhere go? Okay.
Yes,
okay.
Everywhere.
So
Yes.
mental note.
So that is one of the surprising things because I thought it's just the hair on the head.
Yeah.
So eyelashes, eyebrows, even this one's over here.
Yeah.
Nothing. Everything.
Have these ones come back?
Everything. I'm telling you, everything came back with vengeance.
And it's like, hata mwezi nipea break. Like, just give me. This one you can come back in the eyebrows.
Tumesema budget ya waxing hatutaki tena. But here we are. Anyway.
Hey, like, waxing lady, I'm back.
Yes. Yeah. So, basically, so I got a lot of online support at the time. And I'm happy now that we have very many Kenyan women and African women speaking online.
Yes.
And that is one of the reasons why I also shared my story online, because so that if another Kenyan woman goes on Facebook, she'll find a Kenyan woman talking about it.
Exactly.
You go Instagram, you'll find a Kenyan woman talking about it. For me, then I was just following Americans, white women, because they were really out there and sharing their stories.
And that's nice, because sometimes I feel like medicine can be so aspirational. You in Africa, then they're saying, oh, I went for this treatment, it hasn't reached here. You're just there like, wow, okay.
That was also something that was very comforting for me, because I remember someone telling me, why don't you go to India for treatment? I'm like, why? First of all, this is COVID. Me, I want to be around the people that I love. So even if I die, I am here with them.
Had you come to terms that may be the end?
So I knew that it was early diagnosis. So I was like, this one. Then, so I saw the treatment I was getting was the same treatment Americans were getting. So I was like, I'm on point.
We're not so bad.
Yes, they're saying Red Devil, they're getting Red Devil. The separation I'm getting from Red Devil, the Mzungu Zuku are getting. So we would always, like even when I was about to go for radio, I actually looked up, there was a post about what to apply. And I got one of the creams that was highly recommended there. My sister got it from the States, and that was that's what I used during radio. So these groups are really, really helpful. I think patients, survivors, you cannot overemphasize their importance in
and
this
also,
journey.
Because like even in the field of medicine, we can only empathize.
Yes.
Because I'm experiencing it from you. So I can tell you, oh, just do this. You're like, I've tried. It didn't work. But someone else who has gone through a similar experience can tell you something. You're like, okay, fine, and it works for you.
Absolutely. Yes.
What about your family? Your family, your friends? I know it was COVID, so it's still isolation. But how was like breaking the news to them? How did you feel about that whole situation?
So the first, when I got the lump, I first told my sisters, we have they say WhatsApp group for 3 people. Those are the best WhatsApp groups. So I have one with my sisters. So I told them, I have this lump. So the first stages of testing, they knew everything that was going on. So once I went for the biopsy, now I shared with the bigger group where my brothers are. I told them also, guys, this is what has been happening. So now I'm waiting for results of the biopsy. And that's the time I told my mom as well. So she's Uko in Shags. People are not traveling. So now the day when I was going to pick my result, everybody was anxious. And I think my mom kept calling them. Have you talked to her? They're like, no. So when I got my results, it was confirmed. So first, I had my doctor was very hands-on, empathetic, and she really held my hand. So the day when now the results came, I asked her, can I come in with my husband? So we went in with him, and then she would always pull a chair and I sit next to her throughout when she was the results from the days of the mammogram. She'd always like put
this is
she'll even draw a picture of the breast and explain and say, this is it. Very, very patient. So she said, come. So she said, the results are here and it is confirmed that it's cancer. I sat there. Okay. And then I think everybody, there was like an empty silence over there because I think she didn't know what to say next. She's human. Then she said, do you have anything you want to ask me now? I told her, not now. She's like, I understand. It is a lot. It is something that you need to internalize and whatnot. You can, if you think of anything, you can even call me later and whatnot. So now we need to go through to take you what we are going to do next. And she said, it's even okay if you want to cry. It's like she gave me permission to cry. Because now that's when I broke down. And she came and held my hand. My husband came and held me. And so they just sat there and I bawled and bawled and bawled. And I finished. She gave me tissue. I cleaned my face. And I'm like, okay. You were saying?
Like, thank you for that moment.
Yes. So she told me everything that we were going to do, like the things I've spoken about. Then, so after that, I was like, okay, now is to tell the fam-bam. So I posted now in the siblings group. I told them, so guys, this is it. The mother is still calling. People are not picking her call, or they're telling her they've not. Yeah, she was still in hospital. She said she'll call us. She said.
Yeah.
In the evening, my bro told me, if we call your mother, because she's blowing our phones, and nobody wants to tell her.
Like, I'm going through things. Oh my goodness. Okay.
So none of them had courage.
Yeah.
So I don't know if she called me or I called her. And when I heard her voice, I just broke down, and she figured out, this is it.
Yeah.
So we spoke. She comforted me and all that. Yeah. So she's like, you'll be okay. And here I am. I'm okay.
Wow.
So after that, my family really, really rallied around me.
Yeah.
My husband's family, my friends. Guys, please send me flowers. I'll send so many flowers that time. Nowadays, I just get flowers on.
Please address them. The camera is yours.
Oh, yes. Flowers. I had so many flowers. I had to buy like vases.
Yeah.
Everywhere. Flowers. Fruits.
Yeah.
At it reached a point, sometimes I would give visitors fruit. Just take some apples, take some oranges. Now I want the fruits.
And not simple buy the expensive fruits,
Yes, exactly.
The ones you pretend like, maybe next time.
Yes, please, bring the fruits.
Yeah.
Book a survivor. And flowers. Anyways, so people really, really, I got an outpouring of love. And I think that's really what I needed at the time.
Yeah.
Even like during treatment. So my sister was like in my house every other time. My siblings, my friends. It was COVID, but still, they were like, you guys are not going through this alone. Someone will call me and say, I have to come and see you. I'll put on 2 masks and I'll put on gloves, but I have to come and see you. Yeah, so I had, the support was amazing.
Yeah. I love to hear
for
that.
every chemo, my husband and my sister went with me, and they would, like once I'm settled in, and they would go sit like in Java or somewhere on work and come checking on me every so often, but they were there throughout.
Yeah. Wow, because I think for me, in med school, we're not really taught how to okay, we are, but you're not taught in an empathetic way, like how to break the information to someone. And literally, I keep saying this, for many people when they're coming to hospital, that might be the worst day of their lives.
True.
And for you, you're just going on. You're just like, okay, fine, patient 1, I have another one.
Yeah.
I even have someone who sent a comment. I hope I find it. Let me find it. So one of the episodes I did for the motherhood series, it was how she was handled in hospital. I just have to find this comment because I read it and I was just like, that is no empathy at all. Wait, let me find it. Internet, don't let me down now. Don't let me down. Don't play. I know it's going to play. Okay, here it is.
And from me, my personal...
Hi, Dr. Olivia, that's you. So, wait, let me find it. Okay, so she said, reality is hard in the medical field. I remember in 2019, I had a miscarriage, and the way the news was broken to me was horrible. Mama, hiyo hakuna kitu, mtoto ameisha.
Oh no.
I was like,
Does exposure to so much trauma make doctors numb sometimes?
It does. I can't lie, it does.
Yeah.
I think because our system, it's kind of broken. So you have so much to do, and it's hard to linger on one patient. But I don't think that's an excuse.
Yeah, true.
I keep saying this. If you're a nice person, you're a nice person. It's not very hard to be kind to a person for 2 minutes as you move to the next, because their world is literally crumbling. Yeah. So I like what your doctor did, and shout out to her, wherever she is. Shout out to you because you did your big one.
She like, hi, love. We nicknamed her Dr. Love. I hope she'll watch this and know we call her Dr. Love.
You did your big one on that one.
Yeah.
Okay, that's really nice. Now, I had a question. When you felt the lump, who did you go to? Which doctor did you go to immediately?
I walked into... Can I mention the hospital?
Yeah, if you want to. Yeah.
Yeah. So, well, my job involves a lot of interaction with hospitals.
Yeah.
So I walked into Aga Khan because I had nurses there who are my friends. The maternity nurses and whatnot.
Yes.
Yeah. So I went to one and I told her, hey, I have a lump. Where do I go? So she walked with me and she directed me to the breast clinic, breast center.
Yeah.
Then, I forgot to tell you that part. So when I went into the breast center, I'd never been to, I didn't even know that side of the hospital.
Okay.
So I saw a door, she pointed, and I went into that door. There was a reception and there was no one there. So I sat 5 minutes, 10 minutes, no one at the reception. Then a cleaner person, I asked him, hey, there's no one here. He's like, no. We are using the reception on the other side. So just go to that side.
Yeah.
So Kube, this was the back door.
Okay.
Yes. So I passed through the corridor and I felt like I walked for 10 kilometers because it was now the treatment rooms.
Oh, okay, yeah.
And so I'm seeing patients on chemo. I'm seeing, patients with people. And in my head, I'm thinking, oh my God.
Yeah.
Might this be me in case this thing is going where we don't want it to go? So I walked all the way to the reception. I found this guy and I told him, I need to book to see a doctor. Then he asked me, what is it? I told him I have a lump. Then he said, we have 2 doctors. He actually recommended the breast surgeons.
Yeah.
And there's one who is out of the country. There's another one. So can I book you? Then I said, yeah, just book me. So he did his thing. Then he gave me the slip. I think I was going to see her the following week. And he told me, I hope I don't see you in this clinic again. That's when I had something called a kiwaru.
Like, that you measure and you feel it.
So see, I'm walking out of the clinic, I'm back to the car.
Yeah.
The kiwaru exploded. So now I'm just walking and crying.
Yeah.
I don't know why I was crying, by the way.
What do you mean you don't know why you were crying? You've just walked through that whole experience.
But I don't have cancer yet. I've just booked to see a doctor.
I keep saying this. Your mind can be your worst enemy. You don't have it, but your mind is telling you that could be you.
Yeah.
Yeah.
I think what really affected me most was the fact that I saw patients when I saw the patients on, both sides of the corridor. So I went and I sat in my car. I sent my husband a message. No, I tried calling him. He was in a meeting. Then I sent a message now to the WhatsApp group of 3. I told them, I've booked the appointment. Now I'm in the car, I'm crying. Then my one of my sisters in Kisumu, the youngest is in Nairobi. She just asked me, where are you? I told her I'm in the Aga Khan parking. I'm in my car. She said, don't leave, I'm coming.
Oh.
She was in an Uber going to KU.
Yeah.
She came, she sat with me in the car and, just comforted me and said, whatever the outcome will be there for you. I'll come with you for all the appointments. And she stood her word. She did come with me for all the treatments. So after I composed myself, she's like, okay, now let me go to school. Wow. Are you okay? You can go home now. I'm like, yeah.
This is
go
the
home.
last one, the smallest.
Yes.
Aww.
Yes.
Wow.
Yeah. Yeah. So I think I had support from day one. Yeah. So what did you ask me?
I've forgotten. I've remembered. I'm proud of the last one. I'm just sitting here. Yeah, proud of you, last one. I asked you, which doctor did you go to?
Oh, yeah. So it was a breast surgeon.
Okay, you've answered the question.
Yes, it was a breast surgeon. And I usually highly recommend her to anyone who comes to me and tells me that they have a lump. I tell them, even if you're not going to be treated in that hospital, I really want her to be your first experience.
Okay.
Because I think it determined a lot the attitude I had and just my overall outlook towards the whole journey.
Okay. I think why I asked that is because many people assume that for any breast issue, you go to a gynecologist. But now that you went to a surgeon, you were directed well.
And specifically a breast.
Yes, a breast surgeon.
I think we have a good number now.
Yeah. So many people start with a GP, just a general practitioner. Then you'll be directed to a breast surgeon or a surgeon. And then if it needs to be escalated, then we have subspecialists, like now the oncologists, etc.
So the oncologist told me that once it is confirmed that it is a cancer, now that's when
hand over.
Because if all of us went to the oncologist, they'll be overwhelmed, and I don't think we have enough of them in the country.
Yes.
So they really like.
Oh no, we don't. We don't.
Yeah. So they really want the more general doctors to filter and just send to them the confirmed cancers.
Yeah. Because actually, as you mentioned earlier, a lump can be benign, malignant, so there are other causes.
Yes.
Yeah. So unless it's confirmed, then now oncologists take over.
Yes.
Now we can't end without talking about your mental health and how now you came back to being Eva and how you are now. Yes.
Internet. The internet has good things.
Okay.
So
and bad as well.
Yes. More bad than good, maybe.
Okay.
Anyway, so when I was searching for anything
Yes.
and everything at the time of my diagnosis, first I found the support groups I talked about, those triple negative breast cancer thrivers, triple negative breast cancer sisters, triple this, that, you know. Then I found a page called A Fresh Chapter. So A Fresh Chapter is it's an American NGO, and they have programs for, I would say, for mental health. They help you, they equip us with tools to navigate the emotional everything that comes with cancer. So they had a program called Ignite, which is a 10-week virtual program. And they had said that they are taking the next cohort, I think, in about 4 months. I put a reminder, I will apply.
Yeah.
So I applied and I got into Ignite. 10 weeks, you're taught different tools, you know, how to manage the mixed feelings.
Yeah.
Sometimes you're feeling high, sometimes you're feeling low. How to deal with the emotions, how to show up for yourself, how to show up for other people. So this is a program that is for anybody who's been impacted by cancer, not just as a patient. Caregivers as well.
Yes.
Yeah. So I did Ignite. And during those 10 weeks, I got to, you know, to meet other survivors and people in that space. So that really helped me a lot.
Yeah.
And then there's this other American thing again. It's called Tiger Lily Foundation.
Okay.
They also had I think it's a 6-week program. And when you graduate, you become somebody called an angel advocate. So it also teaches you how to advocate, to be an advocate and to speak and to for yourself and for others. Then now angel advocates are usually called upon for like speaking engagements. So I've done, I've spoken for some of their American things. I'm international.
Yeah.
Msinione tu
We are
hivi.
imagine we are sorry. We didn't know your game.
They have I think it's a monthly thing called Pull Up a Seat, where they would have like a panel of
Or like
survivors.
pull up a chair.
That's the name of the
That's a nice
thing. Yeah,
that's a nice name.
Yeah. So I remember there's one I did. It was I think talking about bone health post chemo and whatnot. Can't remember the other one. It's been a minute. Then there's something that they also called Tiger Lily Angel Twitter takeover, where for like 2 hours it's like Q&A. So I've done a couple of those as well. So it's just about being taught how to be out there and use your voice and your story to do what we need to do in terms of awareness, inspire, spread hope. So those, I think, are some of the things that have really put me in this mental space where I can sit like this and speak confidently and say everything that I need to say.
Oh, that's lovely. And how was work? How was going back to work?
Wow, work.
Is that a trigger?
Kinda.
Oh, sorry.
But these are things that have to be said.
Yeah.
So it was COVID year. So for the better part of the year, we were working virtually. And unfortunately, there are times when I could be at work and going through chemo. So you're on a Teams call. Those days it was Zoom.
It was Zoom.
Zoom was the thing. So I would be there because you have to be there. And then I finished chemo. Then radio, I would go in the morning, have my radio and go to work. It was 6 weeks. I think I had, no, it was 4 weeks. I had 20 sessions.
Okay.
No, I had 20.
Oh, 20.
Yes.
Okay.
Yeah, so for 4 weeks, I go to work in the morning. I go for my radio, then I go to work. Times when I really had like a meeting I cannot miss in the morning, I'd go to work and then uko in between, rush to the hospital, have my radio, and then carry on with my day. I stopped working because I was on treatment from June till Feb. Now that's from surgery, chemo through to radio, till Feb. And I think I worked till, is it July or June 2021? And so for 1.5 years, I didn't work.
Okay.
Yeah. I would have wished to still be working, but, well,
Yeah.
So, but I'm grateful that I had that 1.5 year break, because now that's the time I really immersed myself into all these things that have built me to what I am now.
Yeah.
So that's when I did the Ignite, I did the Tiger Lily Angel Advocate course, I did random certificates all over, you know. So, and because I also didn't rest well during treatment, so it was also time for me to just recover and recalibrate and get back to me.
I like that. Now, how would you have liked the work situation to be handled differently? If you were an employer, how would you have done it differently?
Well, 2020, which it was a tough year for all businesses.
Yes.
And I don't think that would have been the year that you would have used to gauge somebody's performance. It was COVID year. This is somebody who was going through cancer treatment.
Yeah.
But that's the year that you decide to say that this person has not delivered. Yeah.
Okay. Understood. Point taken. Yeah. And I think sometimes when we have these conversations, it's also so that people in positions of power can really understand the behind the person.
Yes.
Because, as you said, you show up to work and maybe I'm giving you what you want to see, but you don't know what's happening behind. And sometimes, I know people say, oh, no, separate work from life. Sometimes it can be hard.
I cannot separate work from life because I'm working because I have a life.
Thank you. Yeah. So, when you become an employer, at least now you'll know what you'll do differently.
Absolutely. Yes.
Yeah.
I definitely do.
Okay. Now, we can't end without two things. One, teaching about some of the signs of breast cancer, signs and symptoms.
Okay.
And number two, you can shout out to your support system, your community, because during Breast Cancer Awareness Month, we also want to acknowledge that there's a whole community behind you and any other survivor who have walked this journey with you. Yeah. So do you want to start with the symptoms?
Yes, I think let's start with the symptoms.
Okay, Sarah.
I think the most obvious one is definitely alarm.
Yes.
And I think it's easier if I talk about how to look for...
The floor is yours. Your camera is there.
Okay. So you can see me up to here.
Yes.
Okay, that's fine. So what you do is, number one, I hope everybody knows that the breasts are not the same size. So don't be alarmed if one is bigger. You might think, hey, this one has furad, it's sick. No. So we encourage to have a breast self-examination every month so that you know you're normal, know what your breasts look like on a normal day. So first thing you do is to stand in front of a mirror and then look at the breasts, then raise the hands and see how they rise. So they should rise together.
Yes.
One should not be left behind. Even the bigger one should go up with the smaller one.
Yes.
And then, so check also, do the side view as well. Look at it from the left side, and the right side, and also just bend forward and then, just visually examine and see what they look like. Then look and see if there's any changes in the skin. Is there a rash? Is there something like a pimple? And then squeeze the nipple to see if there's any discharge. If you're not breastfeeding, you should not be having any discharge.
This is a textbook.
So, and then now just start palpating slowly in circular motion from the inside going outside. Softly, press gently and feel for any lump. And then go all the way up to the collarbone and also the armpit. Repeat both sides. You can do it lying down as well. Do it in the bathroom, especially when the body is soapy. I think it also feels better when the hand is just gliding. That's how I found mine.
Okay.
So do this every month at the same time. Maybe a week before the period or a week after.
Oh, yeah, because of the changes.
Because of the changes. There are times of the month when the breast is fibrous, you might get false lumps. So it's simple. Just know you're normal. So one day you will find something that is not normal, go to your doctor.
You've done it so well. Those are signs and symptoms.
Signs and symptoms.
Yes. And that's for early cancer.
That's for early cancer.
Most of the time. So sometimes when it may have progressed a bit more, you might have now the signs of cancer where you're fatigued, you're having nausea and vomiting, maybe you're losing weight. Exactly. So it's also some things that you can also
And then sometimes the breast becomes bigger, it becomes hard. The skin becomes darker.
And the orange, you remember
the orange peel?
The orange.
It starts dimpling.
Yes, dimpling of the skin.
Yeah, the skin starts dimpling. And so even the nipple can change. It can invert.
Thank you.
And so just know what your normal breast looks like.
Yes. Wow. And for actually heavy busted ladies, lift.
Yes.
Lift the breast. Feel under.
It's even best to do it when you're lying down.
Yeah.
So that now when it is spread nicely, then you can feel every area around the breast.
You've done it justice. I think now we can end with you thanking your support system. Shout out to them.
Oh, my support system.
Yes.
My family, my everything. My children, who were very good during that time. They were very understanding. My husband, who stood by me. My mom, who unfortunately passed on last year. God bless you. My stepmom, who is still loving on me. My brothers, my sisters. You guys, my people and my friends. All of you who came to see me, who took time, who came to laugh with me, who made me feel like I belonged. I actually can say I did not experience stigma because of the people around me. And I have this crazy group called Boss Moms. They took me on a holiday when I finished treatment. And it was a surprise.
Hey, that's the best way to do it, actually.
Yeah. So I just was told, we are going somewhere. I go there and I find women with matching T-shirts and skirts. They're like, surprise! Yeah, we had like a 3-day vacay somewhere. And, they did a lot of things for me. We lit candles for those who left us. We had cake. It was nice. And I think the family now that I got after, there is a fresh chapter. And all these many groups that I'm in, oncology nutrition group, triple negative Kenya warriors. Then I am the current secretary for Kenya Network for Cancer Organizations.
Okay.
Yes.
All right.
It's the umbrella body for all cancer CSOs in the country.
Okay.
We are into advocacy and just fighting for the right things to be done for cancer patients. Yes, and I try to educate on my social media.
You do. Why are you saying try? You do educate.
I used to be very consistent.
It's okay.
Hapo awali, but I'm getting back to it. So this October, I think I will... October, I'm normally serious in October.
Yeah.
So yeah, I'll talk about different things, tying them with my story just so they can be more relatable. So yeah, be there and get to learn. Don't miss out. Yes.
Okay. Now, I didn't want to make it too technical because I think we get a lot from just someone's experience. So if anyone wants to learn anything else, I will put more information and try and make like just short clips on what more they need to know about cancer. I know we mentioned triple negative. They're like, what is that?
Yeah.
But don't worry, we always put captions for people to read and learn a bit more. Yeah.
I'm actually doing I'm not doing a webinar. One of my groups has a webinar.
Yeah.
On the 10th of October. I know Kenyans will be on holiday, but I'll be speaking about triple negative breast cancer, simplified, because now this is from a patient to patient.
Yes.
Yeah.
Perspective. Okay, I like that. Is there any other avenue that people can get more information from breast cancer that you'd like to share? Especially in Kenya.
In Kenya?
Yeah.
Kenya Network for Cancer Organization.
Okay.
Their website has lots of resources.
Okay.
And I cannot overemphasize, please talk to doctors. I know, and especially now, we didn't talk about myths.
Oh, myths and misconceptions.
Diet and herbs. We have good herbs. They all serve their purpose. But I don't think there's a herb that we can say treats cancer. And whatever supplements or alternative medicine that you are taking, please check with your doctor.
Thank you.
And I don't stop your conventional medicine for herbs or supplements.
Na sio mimi nimesema this time round.
And nothing can outdo a good diet.
Oh, that's true.
Yeah, so just
physical activity.
Eat well, drink water.
Yeah. At the end of the day, early diagnosis, early treatment, better outcomes.
Absolutely.
We have her here.
Early detection saves lives.
Yes, it does.
And tomorrow is the 1st. Oh,
Yes, we are shooting on 30th, so tomorrow is first.
Yes.
This episode will come out a bit later.
okay.
Yeah.
So there's one thing, we have a hashtag in the breast cancer space. It's called
Okay.
Feel Them on the First
Okay.
or Feel It on the First. So
Okay.
you'll find many advocates and survivors on the first of every month. They post on their socials some little facts and a reminder to feel them on the first.
Oh,
Yes.
okay. That's good. So that at least you always remember today is when I need to feel.
Yeah, so
Okay.
I try to remind people.
So I'll put it here
Okay.
as a hashtag somewhere. You'll see it
Yes.
somewhere. But thank you so much for coming. Thank you for sharing your journey.
Thank
I know there's so much more we could have talked about.
I know.
But what we've done is it was enough for today.
Absolutely.
Yes. So do you want to be found on social media?
Yes.
Plug yourself, please.
So on the Blue app for old people, that's Facebook.
Okay.
I am Yasmin
Okay.
Allela, with Allela.
I'll put it here. Don't worry.
Yes. And then on Instagram, I'm Eva_Allela. Then there is this other resource, which it's a place of comfort for anyone who has been through loss or cancer, who is grieving and trying to recover. It's called the Whispers of Hope on Instagram and Facebook.
Okay.
Yes, so this one just shares coping mechanisms, a few things you can do when you're feeling low. Yeah.
Okay. And we've just done an episode on pregnancy loss, because October is also Pregnancy Loss Awareness Month. So I don't know which episode will come out first, but I think I'll also put Whispers of Hope as a resource for that episode.
Yes.
Yeah. Okay. My name is I've been told to look here. Okay. My name is Dr. Hope. If you've reached this far, thank you so much. You're a real one. You can find me on Instagram, on TikTok as Dr. Hope Simiu. Don't worry, it'll be here. There are many hyphens. But please follow us on the podcast, A Dose of Health, the podcast on Instagram, TikTok, Spotify, Instagram, wherever you like to listen to us, and leave a comment. And happy Breast Cancer Awareness Month.